Hello and welcome to our ninth sleep seminar series from the Sleep Health Foundation. I'm Dr. Moira Junge, the CEO of the Sleep Health Foundation, and I welcome you. I'm really, really pleased you can join us, or maybe you're watching this later. We've got a very special guest today. I'll introduce in a minute, Dr. David Cunnington, who's a lifelong, well, not lifelong, a very long time friend and collaborator of mine, and someone who's really well known in Australia and internationally in the sleep world. So today we're really bringing you a bit of a snapshot. The start of Sleep Health Week is day one of Sleep Health Week, which the Sleep Health Foundation has run for the second year. We're trying to make a splash of this week and the week leading up to the daylight saving starting, because people really don't like that 1 hour lost sleep, and it's a good time to feature when lost sleep is common for a lot of people. So first of all, I'd like to acknowledge the traditional owners of the land on which we're all meeting. I'm meeting on Wurundjeri land, the land of the people of the Kulin Nation, and I pay my respects to their leaders, elders, past, present and emerging. And particularly the Sleep Health Foundation does take great inspiration from the notion of health in First Nations people, in that it's not an individual concept like it has become in the Western world, that you're only as healthy as your mob. And I like that in terms of us being community facing and understanding that our sleep health particularly is not just contingent on our own individual behaviours. It's actually sort of a societal thing. So without further ado, I'd like to introduce Dr. David Cunnington, who's a respiratory and sleep disorders physician. And he was long standing in Victoria and recently now has relocated to the Sunshine Coast in Queensland, which is a great sadness for us in Victoria, but a big gain for Queensland. So without further ado, I'll actually just get over to talking to David, and really, ask you maybe about your career and what you've been doing and what you're doing now, and tell us a bit about yourself.
Yeah, thanks very much, Moira. And I really appreciate the work the Sleep Health Foundation, under your guidance, has been doing in this area. And it's really fantastic to see the initiatives that you've been working on. As you know, I've been working in sleep for a long time, which is how, we've known each other. And it's just such an amazing area to work in. It's so rewarding professionally.
Yeah.
And as well as that, there's so many unanswered things. There's so much scope for sleep just to, interact with almost every other domain in life. So I just love it. I love it as an area to work in, and being able to not just, see the individual people that I work with in my role as a specialist physician, but to be able to have that sort of broader community discussion about sleep and sleep health and, how we can really have an impact by trying to help people better understand sleep and better understand, how sleep is going to interact for other areas of their health.
Absolutely. So what do you find? I mean, I know what I used to see in the clinic, and what are you finding at the moment? What are the main sort of presentations, or what are people telling you about their sleep right now?
Yeah, so it's really interesting. Definitely it's evolved. So, as a specialist sleep physician, the way it works in Australia, people need to be referred to see me. So there's a bit of a filtering process that impacts what I end up actually seeing in my clinic.
Yeah.
But if I think back 20 years ago, it was very much related to sleep disordered breathing or issues with snoring and sleep apnea. And whilst I'll still see that in my clinic or people coming to see me, it just shows the evolution in sleep medicine that I'll now see a very broad range of things. So people having trouble sleeping, so insomnia, people who are sleepy or struggling with sleepiness or fatigue, and particularly we're starting to see people with long COVID or hypersomnia or sleepiness following COVID starting to come through in sleep clinics.
Yeah.
I see people who do things during sleep or have things happen during sleep, whether it's nightmares that they're experiencing or acting out dreams or night terrors or various other parasomnias, people with movement disorders during sleep, and often too, increasingly seeing people that sleep doesn't feel right to them, but it's actually almost the expected consequence of their other medical conditions.
Yeah.
So they don't necessarily have a primary standalone sleep disorder, but everything else that's going on with their health is impacting on sleep. And, I really I really like seeing that sort of person, because in some respects I can reassure them that it's okay. You
Yeah.
don't, it's
Yeah.
not on you to have to fix this by doing something to fix your sleep. In fact, what's going on for sleep is just the expected consequence of these other things that you're already working on.
Yeah. So in that sense, so the people listening, people who have tuned in today or watching this later, and we've talked about, strategy, rise and shine, and strategies for optimal sleep. Yeah, what do people, I mean, suppose outside of the clinical situation, that's one thing, but I guess this kind of a recording or this sort of a thing is, maybe we could start with what they're likely to get from you, or how your approach is to it, particularly with these people it's not a primary sleep disorder per se. Where would you like to start, I guess, with that, like your
Yeah, so
approach to it?
so I think this will seem weird, right? But I'd like to start by making sure people don't lose track of stuff outside of sleep.
Yeah,
Because very often, although people are coming to see me because they're perceived they've got a problem with sleep, and often very focused on, right, I'm going to fix sleep by doing these sleep related things. Yeah, often sleep is the expected consequence of everything else that's going on in life. And so I find myself doing that both in my clinical practice, but also when I'm doing more sort of public facing things, trying to help educate people about improving their sleep in general, is really thinking about, if I'm trying to improve sleep, what are some of the things in my life that might impact on sleep, and what's going on in those domains, rather than saying sleep in isolation.
yeah, that's right. So yeah, we should almost have a slogan that, you can never see sleep in isolation, or it's an important take home, isn't it?
Yeah, it is. And sometimes I'll sort of reflect back on people or to people, and maybe if someone's coming to see me with insomnia, they've been very diligent in following all the instructions they might have been able to find online, or instructions they've been given by healthcare professionals,
Yeah.
but it's very focused about the sleep. And
Yes.
if we
Yes.
sort of take a step back and go, well, what else might be going on in life that may be contributing to sleep?
Yeah.
Oh,
Yeah.
yeah, I'm pretty busy. There's lots of other things. The kids are stressed or they're not well. And
Yeah.
then, is there something about just your own personality style or your own sort of thinking style, or just about you in general, health, other factors that might impact on sleep? Oh yeah, tend to be a bit of a worrier. I'm a good detail person. I'm a busy bee. Those things impact on sleep.
Yeah.
And
And then the
often,
worry about sleep, that they're
yeah,
particularly prone to
yeah,
the worry about the lost sleep. Yeah, which is important.
exactly. Exactly. And often they've really drilled down and trying to nail all the sleep stuff.
Mm.
But in actual fact, it ain't the sleep stuff to
Yeah.
focus on. There may be some other just general stress management strategies, a bit more self-care in life, without it all just being, I'm going to do stuff for work, for family, for others, but actually take some time out for self as well.
Yeah, I had to, we asked a lot, what are the top tips? And people want to give you want, and I had to give one tip recently. And I said, well, funnily enough, it's nothing to do with sleep. Well, my top tip is actually work out, if you can, and most people do know this, what do you think the reasons for why you're not sleeping well? Like, is there
Yeah.
anything that you can tell us, like put it patient-centered, consumer-led, like what do you think's going on?
Yeah.
First of all,
Absolutely.
and then try and fix that if you can, and then see what happens with your sleep. That's probably the top tip from me. But I like where you're going. Yeah, tell me more
Yeah.
about what you.
I'm on the same page. It's exactly the same sort of approach, Moira, is really thinking about, it's not just, I can't, wash away the sins of the day by doing something magical about sleep at
Yeah,
night.
the magic tonic that comes over
Yeah,
us, hopefully.
exactly. And it's also important of how we conceptualize sleep, or what we expect from sleep. So sleep isn't respite from unpleasant wakefulness, or respite from a life that's overly busy and we just need to check out from. Unfortunately, that's not what sleep is. Sleep, if we're really busy and there's a lot going on, unfortunately, sleep's going to be light and broken up because the mind's going to be pretty busy
Yeah,
during sleep too.
yeah.
So sometimes it's, resetting our expectation about, what sleep's going to do for us in some respects.
So is there an immediacy? Do you think there's people who often think, look, I know all that, but I actually can't wait 3 months or to do I need a solution tonight. Do you think there's that sort of urgency is a bit of a underlying kind of, the foundation of where people do get themselves in a bit of strife with? with
Yeah,
perpetuating sleep problems.
absolutely. And, absolutely, we've all been in that sort of situation where, we just don't have the reserve to
Yeah,
deal with another
yeah,
night of not sleeping well,
yeah,
and we really need a solution.
yeah,
And what I'd hope is that, with work such as your group, the Sleep Health Foundation, and professionals working in the area, we can really have people thinking about sleep in the way they think about other areas of health. It's drifting off a little bit. What are the things I'm going to put into place, rather than it's gone off, it's gone off, it's gone off, it's gone off, and now I'm in a crisis and I need to fix it
yeah.
tonight. So
Early
if we can,
intervention. Yeah,
yeah, and if we can empower people with the tools and the understanding around some of the simpler things to do around sleep, then they just need a little nudge to get things back on track and aren't getting into that crisis situation.
yeah,
But that's really the role for us as health professionals. As often the space we live in is that sort of crisis when people feel like, I need something tonight.
yeah, yeah,
And absolutely, I'm a very strong advocate for non-drug strategies in approaching people's sleep problems. But as a physician, I can prescribe medications, and there are times when people may need a medication. And sometimes that's the situation if they're just really strung out. It's never the long-term solution. It's really the holding strategy that buys you time, is the sort of language I use. It buys you time to then work on those other factors, because they're the things that are going to turn things around.
yeah. Yeah, so this is where, I mean, as you know, I've jumped out of a clinical role really for this health promotion, prevention, awareness, public education. I think is such a key thing, because so many people I would see when I was working in the clinic with you, so many women, particularly, they said, oh, look, they had like sort of they were 63 or something like that, and they talked about it starting with their first child. I thought, wow, it's been like 40 years, or it's been a long time. And I know that there's little things people could have done. I thought, wish you'd seen me, 10, 20, 30
Yep.
years ago. But no one there wasn't a sleep clinic that back then. And even now there's such a problem with access to treatment, as well as even not only awareness. So, I mean, there's all these layers, isn't there? There's awareness that there's help out there. Some politicians don't even know, I think I told you we had a politician, fabulous woman. She opened up one of our seminars this year, and she didn't know there was a sleep field. I didn't really know. And she knows sleep's important. She was very, very supportive. Didn't know there was a field that people would study or work or do research in sleep specifically. So that's a lot of the population don't know that we
Yep.
exist, and how important sleep is, and that there's things you can do to nip things in the bud.
Yep.
So that's why I wanted to pick your brain
No
for the
worries.
next
All
little
right.
bit.
So then I've covered off the not sleep stuff, right? So that's really important. In fact, like you and I've talked about, really the starting point. Yeah, what else is going on in my life? Are there other factors in terms of me and my other conditions that might be important on sleep? So then if we come to, what can we do about sleep itself? One of the things is, think of it as behaving rationally around sleep. And that's, rather than going to bed for the time you wish you could sleep and failing again and again and again, because it's just different from what actually happens, really keeping track of how much sleep am I actually getting and limiting the time in bed to pretty close to that. Now, that's a long-standing technique. It's called sleep restriction. It's not a great name for it, but it's actually a really powerful technique for reducing that time awake in bed, which really sets up a lot of frustration and a lot of perpetuating that feeling of being in bed and being tense and being frustrated. And it works very quickly. So
Yeah,
that's one of the behavioural techniques, or the non-drug techniques, that can work very, very quickly, is this sleep restriction
that
technique.
people haven't heard, like that the 40 years they've been getting into bed, trying to get 8 hours, getting 4, and then being stuck in this perpetuating cycle of frustration. So I
Yeah,
love that. Yeah, that's number one for sure. And that's
number
just
one.
so powerful to get this out to the people.
Yeah. And then the second behavioral component that we use as part of cognitive behavior therapy is called stimulus control. But it's really just getting out of the mode of trying to sleep, because that very purposeful trying to sleep, none of us are going to be able to sleep if we're really trying
Yeah,
to sleep.
doesn't work. Sleep
Yeah.
effort, call it in textbooks. And
Yeah, exactly. So if you're awake and you're feeling like you're not going to go to sleep, you've got to break that cycle, do something else
get
until
up.
you
Yeah,
feel sleepy.
or do, yeah.
And then the third behavioral thing that I think is very simple to implement and very powerful is that keeping a set arising time.
Mm.
So just as that anchor point, now that we are starting to understand how important the circadian rhythm is to managing not just sleep, but health,
Yes.
physical and mental health, that fixed arising time each day where we're up and we're giving those signals to our body that, hey, this is the time that the day starts, is really powerful, both in terms of, regulating sleep, but also improving health. It's also increasing data that just light exposure helps with alertness, helps with vitality, mood,
Yeah.
all those sort of things. So it just helps also mitigate or reduce the negative impacts if you're not sleeping well. So it helps reduce a lot of those symptoms that can occur.
Yeah. Did you see? I mean, of course, you would have seen that the National Sleep Foundation put out a consensus guideline statement a couple of weeks ago, and really focused on that consistency. That, which I love. I'm so glad, because we've talked about it for a long time. It hasn't
Yeah.
been in the literature as strongly as it is at the moment.
Yeah.
So, and because duration, or timing, hours, minutes of sleep is what people focus on.
Yeah.
And particularly commercial, they've got out ahead of us with monitoring their sleep. And it's not really a big deal to me, or to how many hours or minutes people are getting. It's actually the quality of it and the timing of it and the consistency of it
Yeah.
is what's more important. And I'm so glad we're starting to get these messages out to people that, that, especially anchoring because you have less control over the time you get off to sleep. That changes with, your racing mind, or you're going to a wedding, or you're doing stuff, or your kids are waking up. But you can have a bit more control over the time you rise and get out of your bed and out into the light. Most of us have a bit more control over that.
Yeah. And so there are good sort of 3 starting points that have an evidence base behind them, that are practical and easy to implement. And also good research around those sort of strategies being used in primary care, so in a general practice environment.
Yeah.
It's not limited to, well, you only get to do that when you come to see a specialist and you've had to wait months to get there and things. So yeah, really practical strategies. And importantly, none of those things are those sort of bullet points of, all those sleep hygiene measures.
That's right. None of them do this, do that. Not too rigid.
And yes, it's important that people are respectful of sleep and not disrespectful by doing all the wrong things. But you're not going to make your sleep better by really drilling down and having this very long list of items that you need to get just so or just right to be able to sleep.
Yeah. And the sleep hygiene list could be just much simpler. We've got to come up. That's our job, to come up with the slip, slop, slap equivalent.
Yeah.
The dark room, or dark conditions, cool, quiet. So make it for a few things. Yeah, but I know I'll go on.
It's interesting, the light and these types of things. Now that I'm in Queensland, no daylight saving in Queensland, and it's already light about 5:30 in the morning.
Yeah, but you love that. You're in heaven because you're an early bird. Yeah.
Exactly, right. So it suits me, but it does actually really shows you how, as human beings, we respond to light and we respond to our external environment. Because, now I ask people in Queensland what time you go to bed, and it's significantly different to when I was living in Melbourne and would ask people what time
a lot
they go
earlier,
to bed.
you mean?
A lot earlier, and what time people get up.
Yeah. Yeah.
And so we don't live in isolation from the outside world and the light and dark of the outside world. And so sometimes we, maintain these very rigid patterns around sleep right across the year, independent of seasons and independent of the time the sun gets up.
Yes.
We need to be a bit more flexible and a bit more attuned to what else is going on
It's
around.
hard because sometimes our workplace and our children and our pets, they don't have that flexibility that we might like to have. Well, we're just aware of our lovely audience, and that we should put it out to. We've got 10 minutes remaining, and I'd love to put it out to you, the audience, if you've got any questions. You'll notice we don't have a chat function on the Zoom that you're on, but we do have a Q&A function. And so feel free to put your message into Q&A anytime, and or I think you can take yourself off mute. Maybe you can work out. I think there's a way of actually talking as well if you wanted to. But at the moment, at least, put your question into Q&A if you have anything for David particularly, or for me. But David, while we're waiting for the questions to come in, I suppose. Well, there's one. There's one that I'll read straight away. From Lauren. Thanks, Lauren. What is the best approach to support people who rely on a radio to fall asleep? That's a really good question, actually. I'd love to know your thoughts. I've got some thoughts on that, but what are your thoughts on that, Dave?
Yeah, so So in some respects, a lot of us need a distractor to be able to just, interrupt those ruminations or get caught up in not getting caught up in a lot of ruminations. And so white noise, if you think of radio as a form of white noise, can be quite a good distractor. Moira and I, we speak about this often, that some of those sleep hygiene measures is, right, go to your dark room with no phone, no nothing, lie there silently in the dark.
And let your mind go crazy.
Think about anything. And so it's actually quite impractical, particularly if someone's, tends to overthink things, bit of a ruminator, which is a risk factor for insomnia. Yeah. So I'd much prefer a distractor like radio. The thing I don't like is if somebody's distraction is really complicated. They need all these different things because then they can't travel, they can't go and stay somewhere else, they can't go to a friend's place. Yeah. So radio is actually okay.
Yeah. What about my answer to that is I agree. And Secrets of the Sleep Health Foundation CEO exposed on the Sleep Health Week that I quite like listening to a podcast to go off to sleep, but I set it to go off in 15, that I only hear the first 15 minutes. So the thing about radio is that most of them, they don't, depends if it's digital or not, they can't turn it off. And I think there is some research showing that people have recalled what it was said. So so I think they're tuning in a little bit too much if it goes all night. So if possible, would you agree, Dave, that sort of if you can turn it off, it's better?
Yeah.
After the initial 15 minutes or so, if you did need just a distractor.
Yeah.
I'll get through some of the questions. I think this is a good one too from Simone. Is it important to get some pre-midnight sleep, or is that a fallacy? This is a golden oldie.
Yeah, I love this one. So, there is a saying, an hour of sleep before midnight's worth 2 hours after midnight. And you can trace that saying back to the about 500 years ago to puritanical England, along with sayings like the early bird gets the worm. So it's just attaching this virtuous nature to being up early in the morning. Now, as an early morning type,
yeah, I was going to say you're virtuous.
Yeah. No, so it's total rubbish. In the circadian sort of understanding of things, people are much better off getting sleep in sync with their biological clock. Now, as long as that's not too far out of sync with what we talked about before, the sun clock, so the time the sun comes up and goes down where they're living, then a late night type is better going to bed at midnight and getting up at 7:30 or 8, rather than trying to force themselves to be the 5 a.m. gym junkie, because they'll just be constantly fighting against the tide and just not quite aligning with their biological rhythm.
Yeah. So it's true only for morning types, basically, really, isn't it? It's like, for me, it is. I know for sure, because I like to go to bed early and get up early. It works really well for me. I know that it feels better. The more I get before midnight, it feels better than if I was, especially when I was a shift worker. If I could sleep from 8 a.m. in the morning through till 4 p.m., I just didn't feel at all very good, even though it was 8 solid hours. Fantastic. Thanks, Simone. Thanks, Dave. And this is from Lucy. What are your thoughts on sleep apps? Yeah, really good. Anyway, can we become slaves to all the results they spew out? I'd love to.
So yes is the answer. But there's, like all things, there's good and bad.
Yeah.
There's the opportunity for the sleep app to create an anxiety about sleep or reinforce negative thoughts about sleep. See, I know I'm only getting this amount of light, not enough deep sleep, or only this amount of REM.
Yeah, 12% REM, like really specific sections.
Whereas it looked at it in a different way. It can provide reassurance. So some of the apps used to allow reporting the sleep data in a week. So rather than looking at the day-to-day sleep length, you could look at the week-to-week sleep length. And when you look at it that way, it's reassuringly stable. And so rather than it being, I only slept this much and this much, it's like each week I'm getting about the same. And that just tells you, oh, okay, well, something's regulating that. My sleep mechanisms are working.
Yeah.
So it is very much how you use the data. They could be used for good or they could be used for bad.
Yeah. And that's a great summary of I was involved with a piece for the conversation, an online sort of journal, or not really a journal, what is it? What did you say? An online kind of website, really, isn't it? The conversation. But anyway, we summarize it really as it depends on whether you feel it's helping or hindering at the end of the day. because it, does it help you and say as a great incentivizer and motivator, and it's really good to stay on track? Or do you think that it just increases my anxiety and I'm, these sort of slaves to the results, and then too much over monitoring of anything in health is not good? It's similar for food and for, eating disorders, etc. There's a lot of, we do try and steer people away from the monitoring. So it depends if you've got a sleep specific anxiety or not. If you're just kind of really interested and you find it really sciencey and you love it, then I think they're really great. But it's, I think, helpful, hindrance, and people make their own, again, consumer led. Patients make patient. Here's me with my old jargon language. People making their own decisions about how it helps them or not. So that's really, really great. So here we are. We could talk. We're doing these webinars every month. Another question here anyway, but we'll wind up soon. When someone is not sleeping and complaining of pain, is it worth addressing sleep before addressing pain, or should pain be addressed first? Another excellent question. Over to you, Dave.
So this is I think an excellent question, because it really highlights some of the challenges. So trying to address sleep before addressing pain for me is a no.
Yeah.
Because it's almost like you're trying to have this magical thinking about sleep. So if sleep's disturbed, for example, because there's quite a lot of pain, how can you make sleep, not be disturbed?
Override that. Yeah, you can't really override the pain.
Override that. For me, this is definitely in parallel. And so absolutely be trying to manage pain, but then really nice research showing if you manage sleep in parallel, so people's expectations around sleep, their thinking and behavior around sleep with a cognitive behavior therapy type approach, you'll get better pain and sleep outcomes. But it's that parallel management. And that research applies to depression, anxiety, nice research showing exactly that. If you do that parallel management of the sleep and the coexistent disorder, then you get the best results.
Yeah, absolutely. And it was only 10 years ago that was sort of talked about in terms of, I suppose, from a psychology point of view, that the DSM-5 dictated that sleep in its own right should have its own, treatment, if you like. It's not just a manifestation of someone's anxiety or their depression or their pain. That used to always be thought of that, wasn't it? Oh, people can't sleep because of A, B, or C. Now there's much more recognition that all people can't sleep. Sometimes there's bi-directional, and that you parallel. You both need attention in parallel, and it's not so important chicken or egg. Sometimes it's like just give them both good attention, because they are, whatever started it, they're coexisting now anyway, and it's really common, and it makes it obviously increase the challenges of it all. But we know that these sleep things work. We know that cognitive behavioural therapy for insomnia is highly efficacious. And our job is to work with the Australian Sleep Association and others to get really good resources out there to the public, like, really soon. So we'll finish up because it's 12:59. And normally at this point I tell you all to go to our website and etc. But we're launching a brand new website, and I'm so excited. You see, we've got new colors. Some of you would have noticed the new logo, which I'll share my screen again. That we've got, so go to the website by all means and follow us on social media, etc. But from tomorrow, I urge you to look at it after today. Would be the best. So wanted to thank you, Dave, very, very sincerely for your time and your expertise. I think it was a fantastic, really helpful conversation, and I know that the audience would agree. I'll give you, a virtual round of applause.
Thank you.
So thanks so much. And I think there was one more question, but great session, fantastic. That's good. So we'll finish it off there. Thank you so much, everyone, for coming. Thanks again, Dave, and we'll see you all next month. We'll just keep doing these and just keep getting the messages out. Bye for now.
Bye.
Yeah.